I'm Dr. Leon Caldwell, Senior Director for Health Equity Strategies and Innovation at American Hospital Association. I'm very pleased to be here in Minneapolis. We have the distinct pleasure of talking to this unique group of health leaders, health equity leaders, and community stakeholders, as we broadly say you all are stakeholders. I think this is an important conversation for several reasons. One, we often hear about the work of equity and the hospitals and health systems are engaging in, but we typically hear about it from the hospital's perspective. This allows us the opportunity to actually see how that experience is unraveling from a community perspective as well. So we hope to have this synergistic conversation where we're learning from each other. And generally, you all are teaching many other hospitals and health systems about community design for collaboration. And we use that term with some specificity or precision around, it's not just about engagement, but it is around collaboration and co-design for solutions. So with that said, how about we just go around and introduce ourselves? And I'll start from my right. If you could just say your name and your organization.
My name is Keisha Powell. I'm the Director of Equity and Inclusion at Children's Minnesota.
I'm Tiffany Daniels, and I'm the Managing Director for the Minnesota Business Coalition for Racial Equity.
I'm Tony Sani. I'm CEO of the Sani Foundation.
Hi all, I'm Diane Tran. I serve as System Executive Director for Community Health Equity and Engagement at Health Fairview.
Shanae Phillips, a Community Empowerment Manager with Mortensen Construction.
And I'm Allison Pence. I'm a Director of Community Engagement at Abbott Northwestern Hospital and Allina Health in Minneapolis.
Well, welcome to you all. So I'm going to start and kind of give context to a lot of this conversation. One of the exciting and sobering things about being in Minneapolis is that this is what we would call ground zero for our generation's kind of civil rights movements and social justice movements, right? On May 25th, 2020, there was a murder of George Floyd in very public international eyes that impacted the world, right? So if you think about that moment in that period, where would you say your relationship with hospitals and healthcare were prior to that, and think about where it is now?
Prior to the murder of George Floyd, my organization didn't exist. The Minnesota Business Coalition for Racial Equity is the kind of output of business leaders, CEOs specifically, coming together to say the business community should be having an outsized impact as it relates to advancing racial equity, specifically for Black Minnesotans in the state. And there was not a forum that existed for large organizations to get together and do that work together. And it was the letter that was penned by Dr. Mark Gorelick, the CEO of Children's Minnesota, and then other CEOs in the region served as signatories on the letter to say, we need to be doing more. Our organizations need to be at the table. And what do we want to do? What do we want our response to be? And so the MBCRE is a kind of direct result of one of the changes and one of the ways that this community really shifted on May 25th, 2020.
And to add to what Tiffany had just described, for Children's Minnesota, we had an intentional focus on identifying structural racism as really being impactful on the health and well-being of our children and families. So once the murder of George Floyd happened, it really allowed us to bring more visibility as to why our organization was important, being right there in community to really be impactful, not only listening to voice of community, but getting our leaders, as Tiffany described, Dr. Mark Gorelick and other executive leadership, to really engage and understand the importance of this work and how we needed to change within our walls to ensure that we were impacting community in a positive fashion.
I appreciate those comments. We at Health Fairview came from a similar place. Our we have the distinction of having the first hospital in the state of Minnesota, St. Joseph's Hospital, which was founded by the Sisters of St. Joseph, who cared about serving the dear neighbor without distinction. So from the founding of this organization responding to a cholera epidemic at the time, there's been a desire to be responsive to community need and ensuring that those who are most marginalized really receive the most support. And that's been in our DNA for a long time, but we also exist within Minnesota and the community here, which has long been heralded for having the best outcomes in the country. When you look at academics and business and other indicators of performance of health and well-being. And yet the statistics would show that it was really that our white and mainstream communities that were having an outsized influence on the ways in which those indicators were showing up, and that we had really significant disparities in our community. And that was what the murder of George Floyd really brought clearly in the midst of a COVID-19 pandemic. And it was just something that became so clear that it needed to be dealt with at that societal level, because really that was the set of factors influencing and creating and perpetuating those outcomes. And we hadn't had that frank conversation to date.
I would say from Allina Health's perspective, we were already on the journey to becoming a more diverse organization when the murder of George Floyd took place in the community where our headquarters are located, where our main hospital and our system is located. We, as an organization, moved our headquarters to that neighborhood intentionally in 2005 with the intent that there was a role for business healthcare organizations to play in helping to work with community partners. And so we were on that journey when the murder of George Floyd happened. Literally the community around us, a big part of it went up in flames and burned to the ground. And so it very much catalyzed the work we were already doing and really elevated it. We also put together a plan where we are looking at our diversity, equity, and inclusion work from a provider standpoint, from an employer standpoint. We're also looking at it from a supplier component, and then also as a community member. What role do we have to play in helping our organization help move our community partners along and helping rebuild? We have a lot of rebuilding to do.
To kind of piggyback off of that, we're in some similar, our physical location, right? It felt like everything was happening literally in our backyard. And so, there was a lot happening internally in our organization that we were, focusing even more on this work and moving it forward. But we knew also this was something that as a community we hadn't really ever experienced before, but we knew that we wanted to respond quickly and we wanted to respond in a way that was really meaningful for the community and its residents. So we knew there were hundreds of small businesses that were either partially destroyed or completely destroyed. Many of those were locally owned small businesses owned by people of color primarily. And so we saw an opportunity there where we wanted to step in and pool our collective resources. We helped lead sort of a coalition of both public and private organizations to help facilitate those recovery efforts, raise the necessary funding and the resources and everything to really help these communities that were really vital cultural and commercial corridors in our communities, help them build back and recover better and stronger than ever. So, that was one of the big ways that we responded, and our focus was really on bringing people back to those areas, right? Bringing consumers back, driving them back to these vital commercial corridors because, one, we felt that these areas were really integral to who we were as a community, who we are as Minnesotans, who we are as, residents of the Twin Cities. And then also because we knew that these areas were really critical to the continued growth and the prosperity and the continued health of these communities.
And we were one of the organizations that benefited from it. So thank you. Along the corridor, as we got a grant to help redo our structures. Health equity has always been embedded in our work. We were very conscious about that from the beginning and developing relationships with the community. I think in 2018 we got an award from Robert Wood Johnson Foundation where everybody was saying, Tony, you're all over the place. And then they helped us talk about it in a way that people could understand. I think the way that it helped us then partner with hospitals systems is, I think in the beginning, we said, hey, look, this is what we're doing. It makes sense now. And the response in early years might have been, well, to check the box, well, everything is that. And I think what George Floyd did is it made people more accountable to their promises. And I think that they really opened up the eyes to see what effects it was really having, and also understanding the amount of work that it was going to take to do it. And we're on the ground, and we're not clinical, but we partner with and use the research, and together we've been able to make some strides forward and hold people accountable to the promises they made to the community.
Yeah, it seems like a good amount of this work. Anybody who's done any kind of community work, the key word you said, Tony, was around collaboration and working together. So tell me a little bit about, for the community organizations, exactly what that collaboration looks and feels like on the ground.
Collaboration is, really, I'd say, crucial to an organization like MBCRE. We are a consortium of businesses. And I think one of the shifts among many that happened in this community after 2020 was the willingness to work together and this unwavering commitment to collective impact. That organizations may have individually been adopting DEI efforts or had initiatives that were important to driving their business and important to the communities in which they serve. But there has been, I think, a different commitment to working together and recognizing that we all have a role to play, right? The business community working together, various community organizations working together, that, we did not get here alone overnight. And if we are serious about the kind of transformation that this community and this state needs, that we all must be working together.
Well, and so Mortenson and Allina, we've had a pretty close connection over many years, and we partnered in a lot of different ways. I think, Allison, you mentioned the supplier diversity aspect that your organization is working on, and that's something that Mortenson helped plug into when you guys were kind of, as you were developing that and kind of figuring out, what to think about as things evolve and that sort of thing. So we partnered in that way. But I think that one of the things that makes such a good partnership with our organizations is because we share that commitment and that goal of wanting to transform our communities and leave them better off, right? When for Mortenson, it's leaving a community better off than when we arrive, right? And so, very specific example, I think, with the Care Pavilion that's going up here this year. Mortenson as an organization, we have a lot of expertise in how we leverage our large scale projects like that to really help spur economic growth in the area. And I think that's probably one of the reasons that we were selected as the contractor on that. But on this job, we're going to be standing up a workforce program, understanding that gainful employment is really one of the biggest drivers in building wealth in our communities, which in turn helps deliver more equitable outcomes across the board, including health equity. Mm-hmm. So the workforce program really focuses on hiring local folks from the area, a focus on introducing more women and more people of color to the industry, providing some entry-level hands-on experience, and then really that could be their first step into a career in the industry and some steady, livable wages. We understand that together, right? This is the way that we're partnering to help provide this cornerstone for a healthy community.
Tony, tell me a little bit about exactly what your organization does and how you partner.
It's a youth development organization, and now it's been a community wellness organization. So like I said, we are redefining and rebranded ourselves in community well-being. We focus on the social determinants. We have 45 mentors embedded in 15 public schools. 80% of the staff are of color, and they say behavior changes a lot with these kids. And I said, well, they do, but a teacher's behavior changes a lot when you put other people of color in the same building as them. And that's our largest program. It's funded through Department of Education. In the summertime, when we're not doing that, we run free camps for 8,000 kids, and we hire 150 high school kids. So again, focus on the determined summer jobs, employment training, Monday through Thursday. And on Friday, we would visit somewhere like Health Fairview and learn about different positions in their hospital. All the while, as 8,000 kids are going to camp for free. and getting access to T-shirts and water, and we partner with their. I think we did a portion on sun safety, which is often overlooked for communities of color. Nutritional, so what we feed them, exercise and health and wellness, and even community well-being as far as sustainability. We have the Green Stick Army, so the kids actually leave every park cleaner than when they left it. The Conway Community Center is where our hub is our home. We've redeveloped a sports complex, and it's the largest dome in Minnesota, which is important. And it's multi-generational, meaning that the elders from the community use it during the day and the young kids in the afternoon. And really everything from STEM to walking to exercise. 28 languages are spoken there. And then, after COVID came, we got into the food business. And this is where our partnership with mHealth turned from a partnership to a strategic partnership. So we sat at the table with them and other nonprofits, and it wasn't about who's going to do what or who's going to get credit. It was what needs to be done.
This whole notion of community well-being is a significant turn, right? Particularly for nonprofits thinking about, are you serving poverty or are you solving poverty? And it seems like this notion of anchoring on well-being is pretty progressive, and it's thought-provoking because it's a conversation we typically don't have in collaboration with each other. It's like, how do we get the next thing out versus the long-term projection of well-being? So how'd you find Tony? Where did he find you?
Well, he's pretty well known across the globe if you are a soccer aficionado. But we're fortunate because when I first came to mHealth Fairview in 2015, we were a smaller organization then and had a real commitment from the board and the CEO to try to think about how we build the capacity to partner with community. We recognize that these social determinants of health were a significant challenge to our goal of, patient and family well-being. And so how was it that we could step outside of our hospital and clinic walls and partner with others, which required us to approach with a lot of humility, come with questions and resources, but not necessarily answers and predetermined objectives, and really focus in on a particular area and say, on the east side of St. Paul, 3 specific neighborhoods and zip codes where there were significant levels of poverty. There were federally defined census tracts of food deserts, that there were needs, and that there were community members and community organizational leaders that were committed to the local areas that were open to conversations with us. And so we focused in there on starting just an initial collaborative that was focused on conversation and also incorporated talking about assets in the community, not just deficits and challenges to be overcome or problems to be solved. And it was there over the course of several years that we got to know many community organizations and partnered to co-design and co-implement solutions related to mental health and stress resilience and culturally responsive access to healthy food. And that was when the Sane Foundation became a part of an effort that we continued to help support and convene from mHealth Fairview, but really over time tried to shift co-ownership and partnership to the partners at the table.
And I just want to add, I think I don't know if we overlook it, but we used to take it for granted. This was really done because of an intentional investment in the community itself. I mean, we couldn't do this without the young people working. And we have young people from the community working and telling us what is needed, connecting the family, gaining trust. And it forced us to look deeper. So not only are we providing jobs, we've started to buy houses for them. We get driver's license, we have cars, we have Get Your License program. So really thoughtful. We have a social worker on staff for all the young people working to say what are their needs to be met. So it was great to get all the other organizations together. And we don't know what we didn't know. And ultimately the community came forward and told us and gave us a path to move forward.
Yeah, it's there's a couple themes I'm hearing in kind of all of you all's kind of efforts. One is the listening is critical, right? And it's like listening with humility. I'm also hearing this intentional investment in the word you use around strategic partnerships, which is different than just regular partnerships, right? Like there's some intentionality around that. The other part that's I think an important piece is around sustainability. Like at some point, our hospitals and health systems, while they serve the the remnants of when families are not receiving some of the societal benefits, as you will, to keep them healthy and they experience optimal health. There's places they have to go outside of the walls of a hospital. And that seems to be this collaborative model of where that actually happens. But what's the essence of like a really good community partnership within a hospital?
You know, the first thing that comes to mind, similar to what Tiffany had described earlier, is really that collaborative effort. We're all working towards the same goal. We're all passionate about the work that we do and being very intentional on how we start the work. So we understand that there may be hurdles, right? But even if it's that quote unquote low-hanging fruit, what are things that we're already doing that maybe we don't recognize that we're each doing, but collectively we're going to be stronger in numbers? So I say that because you think about with the Minnesota Business Coalition for Racial Equity, and I have an opportunity to lead one of the pillars, which is really that employment opportunity focus. So working with 50 or so employers and leaders and thinking about what are the current activities that are taking place. And as we all know, at times we may feel like we're competing for talent. There is a shortage. However, how do we all collectively think about how do we not only attract talent, but retain talent and advance talent, not only within our organization, but develop strategies and processes in which we're able to do that for a larger group of individuals, not only within community, but within the state of Minnesota. So I think about some of those collaborative efforts are really going to be key. I'll let Tiffany talk a little bit more about some of the work from a policy perspective, but I can share this as an example on an opportunity where we as an organization had the ability to collaborate with the Minnesota Business Coalition of Racial Equity and be instrumental in the Crown Act recently being passed. Our president and CEO, Dr. Mark Gorlick, testified at the Capitol alongside Tiffany, and we also had our Chief Equity and Inclusion Officer, James Burrows, co-write a letter of support as well, in addition to members of our Collective for Community Health team, really be instrumental in advocating, being, an advocate and a voice for our community members, but also sharing and making our work visible, not only internally, but externally within community to show our commitment to this work, which drew a lot of, I guess you could say, visibility, but also got individuals more excited and passionate about the work that we're doing and how can they too be involved, especially in areas that they maybe didn't feel knowledgeable in. So I think just to summarize, it's really that collective buy-in, really listening to various stakeholders, whether you're a small organization, large organization, various industries, but recognizing what do we all have in common and how can we utilize that to catapult the work that we're doing in this space.
And Tiffany, can you just give a synopsis of the Crown Act? Because many of our audience may not know what that is.
The Crown Act is designed to essentially ban race-based discrimination on the basis of natural hair. Minnesota passed the Crown Act in early February and became the 20th state in the United States that will support amending our Human Rights Act to add protections for those folks that wear their natural hair in the workplace. And also it extends protections to kids in schools, which was part of the impetus for the partnership with Children's Minnesota, as we want to send a message to our youth very early that the way that they are made and the way that their hair naturally grows from their head is acceptable. I do want to build on Keisha's comment just around the partnership with Children's, because I think one of the other marks of a really strong and intentional partnership is that it must permeate the organization. It has to show up in multiple places. And I think previously, partnerships may have lived only in your community engagement department or only in your foundation, right? And I think now we're in a place where it is, okay, how might we bring the full might of our organization to this partnership?
That's a really important piece when you think about, oftentimes we use the word sponsorship, right? And sponsorship meaning just dollars, the transfer of some wealth, if you will. But what I hear you saying, Tiffany, and I know I've experienced this with our work with M Health, there is some intellectual currency that you all have, some skills currency that you all have. how do you use the skills currency across your partnerships, particularly hospitals into communities and sometimes communities into hospitals?
It's a great question, and I think it does still involve the whole package of assets, right, that are shared between organizations. I think for us, a lot of that was just how we architected what community partnership meant and created a structure for it that acknowledged and tried to address some of the power dynamics. And so when we first started our Eastside Health and Wellbeing Collaborative, we did invite everyone to the table with, great locally sourced food and an open invitation to bring others and to engage. We brought our CEO and key, physician and other leaders within our organization so that we could meet with community, nonprofit leaders, CEOs. Over time, though, as it started to move into prioritization and then the co-design of the efforts that we now know as our Cultural Broker Program and our Eastside Table, we knew that we needed to compensate and adequately value the time of our partners in co-designing and bringing their intellectual capital to the table. And as we progressed from there, of course, the implementation that also required time, insights, mentorship within those communities as well.
So we've had a very similar approach to M Health. I mentioned before how when we moved our headquarters to the Phillips neighborhood in 2005, we started conversations with community very quickly. We came in with the traditional paternalistic perspective that healthcare often brings to community. We're here to save you, we're here to fix you mentality. And we were very quickly informed by community that perspective wasn't going to fly. And to the credit of the organization, the leaders at that time said, "You are right. We don't know what we don't know. We are here to learn." And they had a number of years where they worked collectively together with community partners, especially our community partner in the Cultural Wellness Center, really tried to figure out how does healthcare work with community partners? How do we do this better? And so they created the Backyard Initiative, which was a 10-year partnership that existed between Allina Health and the Cultural Wellness Center, and really worked to help the neighbors empower each other to work on their own health. So it wasn't healthcare bringing things to community, it was healthcare sitting alongside community at the table, working collectively, trying to figure out what do folks in this neighborhood need to be healthier? What can we provide? What can they provide? What resources, what intellectual property do already exist in community that we can support? And it was a great partnership. It continues to this day. It requires us to provide funding to continue that work. It also requires us to be at the table, to be a partner. When they call and say, we need to run COVID vaccine clinics, you have a building, it's not being used right now, can we use your space? It means we say yes.
Yeah, it's interesting because we're talking about this work oftentimes in its current state, right? Like, seems like everybody likes each other now, right? But there was that one point, right, where you ain't like each other, right? And I think the key word you used was evolution, right? These things start someplace and sometimes not someplace good. It could be wonky. It could be out of crisis. It could be out of just frustration. Or it could be just the community telling you, no, y'all, this ain't right, right? Can you talk a little bit about that? Because we want our, the viewers of this to hear the good, the bad, and the ugly. Like it doesn't always start as rosy as, we are sitting here today.
Well, I think there's a realization that our community is not healthy. I mean, I went to get my adult checkup this year, and it used to be I could call and get in a couple of weeks, and now it's like 3-4 months out. So business maybe is too good, and I think we look at and see like what is the capacity of our healthcare systems to support the community if it's not healthy and everything. So I think there's that, and then just on something we said earlier is the knowledge. I think more important than the knowledge and the dollars, because there's this thing called Google now, so you can figure everything out. But I would say it's the social capital of these partnerships that bring in.
And I can imagine coming from, the privilege of a hospital where you have resources. I can go down the hall and get paper, right? Or there's always ink in the printer. And then you start working with an organization. It's taken a while to return a call. right? Or doesn't know where the meetings are, or can't really afford to have refreshments like we're used to having. What's that experience like from what's needed for a hospital to go to where Tony was saying, like understand what it's like to not have the privilege of a corporation behind you and really working like in community, like not for communities, but in communities. It's a different way. Can you all speak to that to some extent?
The way we have set up our charitable contribution process, our community engagement project, really was an evolution of those conversations we had at the very beginning, and very much designed to be not showing up with our own agenda, not showing up with our perspective, but very much coming to community partners and saying, what do you need? How can we help you? And to the point where our charitable contribution process, we will fund general operations. If a nonprofit asks us for a gen op funding request, we will fund that. And I've had many community partners tell me, nobody funds gen op. Everybody expects a project, a program that you have to write a report about. And the perspective from ours is, well, you can't do that if you can't keep the lights on. So if, as a community partner, you tell us you need money for general operations, we are happy to write a check for general operations.
And to add to that, within Children's Minnesota, just the last year, so it was the summer of 2022, we actually created a department called the Collective for Community Health. And what the purpose and intent is to really think about what are our community needs, whether it's food access, transportation, medical, education, etc. And we found that we had various departments that had relationships with other community partnerships, but not necessarily an intentionality behind the why. This team is very instrumental in kind of centralizing all of those efforts, going out into community as you described, listening to the needs and really tailoring our approach, whether it's visibility, bringing access to healthcare into community, or even determining how do we help provide funding resources to support the needs, if you will.
So this is really helpful to kind of position a conversation on telling a story, right? Because at the end of the day, we all see a bunch of numbers. They tell us some things they don't tell us. But what often moves communities, right, and policymakers is truth-telling, right? And in that truth-telling, there's a story in the truth-telling. So what's the story at the end of the day as we kind of summarize our work together?
I mean, tying it back to data, I use the common sense data. You know, we're not doing enough if I keep getting phone calls. I also know that we're doing quality work of the word of mouth, which is as impressive as any documentation that you can have. Is people feel confident that they've been served and feel good about telling somebody else to go there for help, and they actually believe them, and then they call you for help. And you know, I think with that, you know, the story is that there's a lot of people that still need support, and whether we use the data in that aspect of what the population is that's coming for support, where they're coming from, and even measuring like continuous improvement. I think our story is, you know, we're embedded in the community, and we want to leverage our social capital in the community with healthcare systems to use what they know and their resources to help make it a healthier community.
The story that I would like for us to be able to tell about the Minnesota Business Coalition for Racial Equity is that the corporate community here in Minnesota unleashed its scale to advance racial equity for Black Minnesotans. That we all were witness to organizations like Children's and Allina and Health Fairview locking arms to address and eliminate some of our region's most stark disparities, right? I want us to collectively build a future for Black Minnesotans that drives the same economic outcomes for Black residents as we see for white Minnesotans, and to do that through the collective impact of the corporate community. That's the power of this coalition. That's the power of having so many corporate citizens here in this region.
And kind of to piggyback off of what Tiffany just described, when you think about the vitality of our communities, right? So thinking about employment opportunities, healthcare access, even going for more, alleviating ourselves from that reactive need of healthcare and more of that preventative. But beyond that, having community members feel more connected to be also advocates within their community, wanting to partner with organizations such as the Children's Minnesota and or place of employment, et cetera. So really thinking about not only that collective impact to drive those better outcomes that have been described, but how are those community members in turn feeling as if though they can also be committed to this work and impactful in this space?
I would say we are still very much on a journey. We all collectively shared in the trauma of the inflection point of the murder of George Floyd. And I think we gained a lot in terms of working together, but we still have a lot of work to do. We still have a lot of need in this community, and there's still a lot of resources that we could deploy, and there's still a lot of learning left that we have to do.
Yeah, I think, the story of our partnership is really that our organizations, we share at its heart, we share this common goal of, transforming our communities. And, I think all of us at the table have really touched on this sort of theme of an authentic commitment. Whatever that looks like, whatever the mission of your organization is that there is an authentic commitment. And that's part of what has made our partnership really strong, is that we share that. And it's built on listening, understanding what community needs are, not pushing solutions onto people that you think that they need, but really understanding what's happening, and also being able to respond as needs change, right? Things that happen, now will not be the same needs that we need to service in the future. So understanding that those can change. But I think, we bring our areas of expertise together. We leverage our collective knowledge and understanding of things, and, we partner for a reason. Allina has it's a longstanding pillar of the community, really strong relationships, a trusted presence in the area. Mortensen, we're an expert builder, but we also know how to sort of use the building of projects here to help sort of catalyze the growth in communities.
Well, I'm hopeful that it is a story of healing, and there's a lot that has happened here. There's a lot of trauma. There is a lot of disconnection. There has been a lot of polarization. And so there is a need for healing, and there is a need for connection. And, not to look too far into the future, but to say, the example that I was able to speak to a little bit earlier with Sane, where we have, in the old emergency department of St. Joseph's Hospital, this idea of things, values and commitments around caring for community living on and sustaining, right? But that there's an evolution and there's a responsiveness over the generations to who is here now and what's needed.
Yeah, thanks for that, because I was seeing your vision as you were talking about big pictures. So on behalf of the American Hospital Association, the Institute for Diversity and Health Equity, thank you all for your insights, your brilliance, your commitment to this work. And I think the really important part is that, as we heard in our earlier panel with CEOs, this idea that Minnesota or Minneapolis is collaborating. And the key to all of us actually getting to these visions we want is working together. And I think that's the basis of community work, of the partnerships that you all have been able to form. So it does give me hope that Minnesota or Minneapolis becomes really the shining example of what is it when you do unleash all of your resources and leverage them for the benefit of a journey, right? And you are looking kind of ahead. And it's okay to dream and dream what the ideal should be. And that kind of is our guiding star. So thank you for all your work, your time and effort in kind of supporting health and healthcare, not just in your own communities, but really in the country.